So there are some key messages contained within the AAPI recommendations. Firstly, we know that our patients in Atlantic Canada are very different from the patients that are studied in clinical trials. They're older, they're sicker, they're more complicated, they've got more medical comorbidities. And the characteristics of our patients are very different from the patients that were studied in the Triton and Plato studies that compared the new drugs prasugrel and ticagrelor against clopidogrel. We also know that our practice patterns in Atlantic Canada are really very different from the practice patterns that were followed in the clinical trials and the practice patterns that are seen elsewhere in Canada and across the world. And a key aspect of that is our geography and the reality that many of our patients have to travel over long distances to undergo invasive assessment and revascularization. One of the final messages is that I think probably the most important message of all is that when we're deciding about how to use these new drugs in clinical practice is to think very carefully about the risks and benefits and to weigh up the ischemic benefits against the bleeding risks. And again, because our patients are older and sicker, although they may benefit more from an ischemia reducing perspective, they're very likely going to be exposed to a higher risk of bleeding with using a newer and more potent antiplatelet agent. So the main message of the guidelines is selective rather than universal utilization of the new drugs after very careful patient characterization.